just going to introduce for now who you should be able to see, Jeff Lazarus, who's in the Health Systems Global Secretariat office in Copenhagen. And although it says Barley Misuk, it's actually Mariam Thacker, who's in London, who's going to tell us a bit about the survey analysis. Mariam's also with Finnish Communication. We're going to just hold on for a few minutes, just in case any other people join us. So for now, we'll say goodbye to Mariam and Jeff, and talk to you shortly. We're using this webinar, it's partly as an internal webinar, or even a kind of an elaborate kind of teleconference for Health Systems Global, for the thematic working groups and for the board members. And we have also invited members of the Community Health Workers Thematic Working Group. So it's a kind of an internal group in a way, people who are very closely related to the work of Health Systems Global. We were thinking of tailoring things very much towards individual capacity building needs, and you'll see from the survey that we did before the webinar that there's quite a range and variety of social media use already. And in preparing for the webinar, we have discovered a set, or several sets, of really excellent basic capacity building materials, Twitter 101, Facebook 101, and so on. And so what we're going to do today, we're going to kind of really talk more about Health Systems Global and how it's hoping to engage you all more in relation to social media and your roles as in and around Health Systems Global. And then we're going to move on a bit. We want to talk about some of the individual perspectives, not so much the use of individual platforms and skills and using individual social media platforms, but really the way to think and the kind of the some of the key considerations if you're thinking about using social media more extensively. So I'm not sure if we have more people on than we did a little while ago. I think we have 11 people at the moment. So I think we should just begin. And I'm going to start by just sharing my screen as well. You should be able to see some slides as well as the as well as me. You can hide me, I think, if you want to. So we'd like to start by talking about whether or not when we talk about social approaches, we're not just talking about the use of social media. Social approaches are as much a kind of a way of working as they are the use of a particular tool. And when you think that something like, well, over 1.5 billion people have really changed the way they communicate over the last 4 or 5 years, that's the kind of environment that we're moving towards. And when you think about it as a membership organisation, as a network organisation, Health Systems Global largely exists, or firstly exists, within the context of the partners and broader networks that surround it. And we've got one graphic that we just kind of like to share with you to help you think through that. This is a kind of a mixture of the close and loose connections that surround HSG and the Global Symposium as well. And we tend to think about our networks being kind of concentrated in the specialist group that we work directly with, our specialization network, and very often that is true. But when you're thinking more in terms of a networking or a social approach for an organization, you've got to consider the other networks which may be just outside of your reach that work on similar complementary subjects and themes. And also groups of people that you may never have thought of as being interested or relevant to the work that you're doing as an organization. Now, when we think about why, let's think about why is this important at the moment for Health Systems Global. All organizations are increasingly finding themselves surrounded by all things social, whether it's in the things we buy, the way we get our information. And as I said before, as a membership in a networking organization, Health Systems Global, by definition, should be embracing a more social approach in order to fulfill its mandate. And also, we've seen, a rapid change within the area of global health, and seeing that social media is becoming is already a very important source of global health intelligence, and that's only going to grow. So there's some of the reasons why. But HSG is also about people. I mean, there's a very small secretariat in Copenhagen. I'm sure Jeff and Ida will testify in a minute. And so the network and the organization really is about people. And so enhancing the use of social media by Health Systems Global is really also about enhancing the skills of the board members and the thematic working group members, both in their own field and in their own right, but also in terms of their use of social media. In an area like health systems development, health systems research, it's really important to be building communities of interest and communities of practice to act as the engines to drive innovation and research. And so that's a really important part of the field of HSG that people are in. It's also a good way to remind people why being a member of Health Systems Global is worthwhile and what the benefits are. And finally, there's this intermediation. It's one of my favourite words at the moment going on in global health and in kind of global governance in general. I don't know if many people saw the report a couple of weeks ago about the fact that 30% of the World Bank's PDF files on its website were not downloaded once. And there's been all this kind of flurry of discussion about why that is, and the fact that people don't have fast enough bandwidth, or they don't know these things are there, and search engines are not great. And I think the real truth is that, for me, my opinion, the real truth is that no one was talking about it. And now, unless someone is actually talking about the information or the ideas that are out there, then they don't exist. Whereas 5 years ago, there were intermediates telling us what was important. They're just not so important anymore. So HSG is also about people. It's not just about functions and organizations, and it's about building individual skills for networking. So thinking about that, let's just go back to what I was saying about the survey that we conducted before this webinar. And I'm going to ask Mariam if she can show us, just to walk us through some of the results. I'm going to bring one of her slides up on screen, and then I am going to pass over the mouse to you, Mariam, so you can walk through these. And I think you're just about to be brought up on camera as well.
Okie doke.
Hold a minute.
I can hear you, but I can't see you.
Okay.
Okay, you're on.
Okay, I'll be on in a second. Hello, everyone. Thank you for joining us today. So I'm just going to go through the results of the survey that you all very kindly did, and I'll just make sure I have control of the mouse. Have I been given control of Tim's mouse yet?
I have.
Well, if you like, you can just say next slide, and I'll.
Okay, all right, I'll do
move
that.
on for you. That might be
So
easier.
just an overview for the first question, which was which social media networking platforms do you use? You can see that if you look at the green bar, Facebook topped the list, and then that was followed by Twitter, LinkedIn, and Google+. And just a few things to pick up on here. That's not surprising. That's sort of what you get, sort of if you look at general, global, worldwide, what people use. But when we think about it in terms of Health Systems Global, Facebook and LinkedIn, even though if you look at the slide, it sort of looks like they can be leveraged, especially the LinkedIn general groups. It doesn't really work with what Health System Global aims are, which is for dialogue and to build capacity and networking. So really our aims at INISH are to look at LinkedIn and Twitter and hopefully help you sort of use them strategically and in a way that maximizes your very precious time. And Tim, can you go to the next slide, please? Yeah, So luckily for us, you were model answerers in the survey. And when we asked you, are there any social media platforms you would like to use more effectively in support of your work, most of you specified Twitter and LinkedIn, and any other platforms that dialogue. And Google Plus and Google Groups actually came up quite a lot as well. The problem with Google Plus in terms of health systems global is that it's very difficult to use Google as an institution, and it's not set up for that. And we also don't want to spread ourselves too thin. I think the focus will be mainly on Twitter for sharing information and LinkedIn for dialogue. Next slide, please, Tim. And using Twitter and LinkedIn really does support the goals that people did specify. And you all said that you want to grow and strengthen your network, which can do for both LinkedIn and Twitter, actively engage with your peers, promote awareness of your work, keep track of what's being said about a topic of interest, and share your experiences and knowledge. Next slide.
Okay.
And in terms of time, most of you said that you spent less than 1 hour or 1 to 2 hours a week. So what we're really trying to do is be able to direct you to resources that you can be able to maximize your time and really extend the HSG's network at the same time. Can you go to the next slide?
Mm-hmm.
Thank you. So what currently prevents you from using social media? The main things that came up in the survey were time, capacity, and quality. I'm just going to read over some of the things that people said. So they have a lack of time and money to invest in social media activities, and my perception of low mixed quality of information on many social media sites. This is my favorite quote, the next one is, so much garbage. It is distressful and takes time to find really useful info. Then other things that came up with the skills of handling the platform and put off by the incredible amount of noise. So again, this brings us back to time and the quality of the information. And I think this flags something really interesting for me as someone who's using social media every day, is that it seems to be the perception amongst the people who completed the survey is that social media is sort of used for listening and as a source of information. But what we really want to do as your members of board members and of the thematic working group is you're the influencers. You're the people who know about health systems. You're the people who are generating the content sort of at the cutting edge. And what's happening at the moment is you have all the knowledge. If you could probably share that with people in the same department as you or with the other health systems global members. But if you were to tweet it or share it on LinkedIn, suddenly it's being shared with thousands of people who can weigh in on the conversation. If you're just sharing with a listserv or another individual, that information is not getting anywhere. Whereas if you were to share an article on health systems and an HIV reference, and you tweet it or share it on LinkedIn, suddenly HIV people will be thinking about HIV in terms of health systems. And this has this huge potential, as Tim was saying, to expand your networks at the edge. And Tim will pick up on this in a minute. I think that's it from me.
Okay, thank you very much, Miriam. That's really interesting. I'm gonna switch back. I think I'll reappear on the camera in a moment. I'm gonna switch here, and I'm gonna ask if we can also bring Jeff in to discuss a few points as well. And while we're connecting him, let me just say that if other people taking part in the webinar today, and I think there are 16 people now, if you have questions, somewhere down on your console, on your GoToWebinar control panel, there is a space for questions. And all you have to do is just let us know on there that you would either like to you have a question, you have something you want to say, and we can then bring you in relation to either through audio or video. One of the problems we have is we don't know whether people have webcams or anything like that so far. So I've just stopped sharing my screen, Jeff, and you won't be able to see the points that I'm going to talk about, but I'll switch back occasionally just to show you some of them. And the first point is really that a lot of organisations in global health are not really taking integrated approaches to social networking, and they're not really kind of taking social approaches at all. Now, that might sound incorrect when you think of organisations that have millions of followers, but we've done some analysis, and I'm just going to switch back to look at my screen for a second, so I hope I don't lose you. Can you tell? I'm just looking across the room to see if somebody can see my screen here. It should come up in a moment. This is a chart. There's just a second's delay. Right, this is a chart which shows about 2 months of the content analysis of the WHO Twitter account. And it looks really good. It looks really varied. You think, they've got health promotion and research. They're looking at events like the World Health Assembly and things like that just happened, epidemiology and so on. And they're very active. They have over 1 million followers. But if you look at this here, there's 1%. Less than 1% is responses to anything. And 2% is questions. 1% is kind of acknowledging the work of other people. So they're very insular in the way they use their social media accounts. And you can tell that by looking at this data from another point of view as well. I'm just showing you another chart here. And this is a kind of an analysis we did of the same content, but saying, is this inwardly focused, is it outwardly focused, or is it just completely neutral? And honestly, part of the reason we did this analysis was we wanted to see if organisations were using social media in a vain way. But actually, they're not. Most organisations are using it in a very neutral way. But the really telltale for us was that a lot of organisations are doing almost nothing with an outward perspective. They're not talking about the work of other organisations. They're not acknowledging the work of other organisations. And so that's what we really mean when we're saying that other partners in global health are slow to integrate real social approaches. And I think for an organisation, even though Health Systems Global may be smaller than WHO, it's quite possible, I think, to cast a long shadow while all these other organisations are using it in a less, let's say, balanced or social way. And I'm just interested to get your take on that, Jeff. I hope you understand what.
It made me think when you said about the lack of downloads of World Bank PDFs, so World Bank publications, reports, and books, how things have. We're reviewing key health systems publications and messages and announcements from major organizations, but also from our members. So we're quite different from WHO. WHO is obviously governed by its almost 200 member states, but it's chosen to focus its tweets on its own work. And I understand that because it would be very difficult to be tweeting about every health issue for 194 or more countries. So, but we have around 1,500 members and a few organizations that are key partners. And so what the message we've been putting out now as a young organization is for these members to let us know what's important, and we'll take a look and we'll retweet it, we'll link to it in a newsletter or put it on Facebook, as well as ourselves looking through the information in order to sort it so that we address the issue that was addressed in the survey, the issue of time and quality. So we can't promise to cover everything, or that everything we share can't possibly read every book and report that we refer to, but we take a leap of faith when we're, a small leap of faith when sending out information from the key organizations that we think it'll be important to read for the members and anyone else who's tuning into our social media.
Mm-hmm. Okay, great. The other, or another discussion point I wanted to just kind of raise was about the importance of two-way conversation, and really kind of using this as intelligence gathering and so on. But when you talk about two-way conversation, people do think about it in terms of dialogue. But there's also a different way of looking at this, which I think is really important for small organizations that are trying to encourage their members to do their work for them in a way, to be the network and to be the organization. So most organizations on the left-hand side of this diagram, this is a kind of a typical sales funnel that many people use for converting customers to buyers or potential buyers into buyers. Many organizations are aware of this relationship, that they want people to become, their stakeholders to become aware of the organization and what you're doing, to recognize the importance of an organization's work, and kind of get narrower and narrower down and say, okay, now I understand the relationship between the work of Health Systems Global, for example, and my own work, and I can imagine what working together might mean and why it's beneficial. And then getting to a point where they understand it so well, they're actually willing to act or be part of the network, an active part of the network. And then finally get to a level where they might actually do your marketing and some of your communication for you by saying to other people that they know, hey, there's this great organization over here that you should be involved with. But at exactly the same time, there's a similar parallel process going on that an organization must do in relation to its stakeholders. I won't go through all of these descriptions down here on the right, but I mean, in a sense, it's the same. It's essentially the same process of becoming more aware and understand of your stakeholders and understanding who they are and acting on their behalf. And sharing information on behalf of one of your members is a very important way of doing that. So I don't know if that's something which is also part of Health Systems Global's kind of plan, or for me, that helps me understand what two-way conversation means. It's about getting to know one another in both directions. I don't know if you've got any thoughts about that.
I do. Thanks for drawing attention to that. When we started Health Systems Global, we only had one thing, which was the Global Symposium. It was a major thing, but still, we didn't have a lot to say, except that we were planning the next symposium. So it became very natural to be very outwardly focused, as you described it, looking at what other networks, other partners are doing, what our members are doing. Now, for those who are members, they're seeing that we have increasingly more information to provide about us as an organization, the thematic working groups, the further developments of the symposium, and how to engage in so many different ways, be it in the 2 days of satellite sessions, be it in breakfast launches, lunchtime sessions, and the full regular program. So we are using the social media a bit more inwardly, I guess, to report what we're doing. But we are, again, as I said earlier, a membership organization. So we will always try to focus on the work of the members as far as it relates to health systems research. So, and many of those members, or if not all, are parts of organizations that are interesting for the health systems field. So we draw on their organization's work, but also any other relevant organization. And we'll start to see this consolidate a little more, and maybe it will be interesting if you do an analysis in a year of, the pie chart you drew for WHO and others. Where are we? Because I think right now everything has been about other people. It's increasingly about us, given the symposium. But when we report about us, and we say X is a plenary speaker, it's really about somebody else, isn't it? So, it will be harder, I think, to categorize us. And finally, we are trying to be very responsive on LinkedIn, a little bit on Facebook, and very much on Twitter. So when questions do come in, simple questions about the registration or more health systems research-focused questions, we do try and engage to the extent that we're able to. We can't answer every query, partly because it's not necessarily our role to make, being a small secretariat, comments on all issues related to the status of health systems research, but we try and direct people to information and use what Health Systems Global was set up to do, which is to be a platform and a networking opportunity.
That's a good reminder. You're mentioning questions. Let me just say again that if anybody has any questions right now, that you're very welcome to raise them through the question or the chat functions on the GoToWebinar dashboard.
Yeah, please
That's
do.
just
If
one.
anyone on the line wants to jump in, please do send
Yeah.
the questions and we'll see them.
Yeah. And you can either write them or just say, I have a question, and we'll bring you in on audio or cameras, whatever you prefer. And we've got somebody tracking that in the background, so you're not distracting us. Don't worry about that. I just have one more point, and this is 4 myths and 1 fact. And this kind of comes under the rubric of what are you afraid of. And I don't mean Health Systems Global, because I think you're very open to these approaches. But for many people, social media is a black box they're a little bit afraid of, or afraid of the unknown. And on this slide, there are kind of 5 things that are said, and these are things that people have said to us about social media. And we think that 4 of them are not true and 1 of them is true. So I just thought I'd like to go through them one by one and just talk through them with you, Jeff. So people say our stakeholders are not online or taking part. It's not a quiz. We launched something for a World Health, a WHO client last week, a website, and within the first week, they'd had users browsing the site from 180 countries, which is just so. So when people say to us, our stakeholders are not online, it's just not true anymore. Yes, there are many people in many countries that don't have access to the internet, and access is very, but it's changing very fast, and many of the organisations that we want to reach, for example, in ministries or senior people in research, they do have access to the internet and they are online. And we're seeing that in increasing numbers now on social media platforms. It's not core to our work. I'm going to ask you what you think of that one, Jeff.
I mean, being a social media expert is not core to people not, working in social media style companies. But if your organization, your company, your institution has any interest in communications, and if communications is core to your work, then I think so is social media. So for us, we started out and we sent out emails. Then we started with a newsletter, and then we realized there were a lot of other ways and better ways to engage people. So it's become core to our work in that it facilitates the cornerstone of our work, which is, again, providing this platform, this networking opportunity.
Right. And I think that's true for many organizations. We don't know how to do it, is something that people often say to us. And that's true, but actually these things are not difficult to learn, but they're difficult to integrate into your day-to-day work. It's, I can't remember which game it was that somebody said it takes a moment to learn and a lifetime to master. It's not quite that hard. I think it was Bridge that somebody said it doesn't take long to learn, but a lifetime to master. And we were really surprised when we, as I mentioned, we found all these fantastic resources, which were the kind of beginner's guide to using these social media platforms. We actually thought we were going to have to develop them, but they exist already and they're really good. They might not be tailored specifically for health, but they're there. So I think entry is, the level of, or the requirements for entry is definitely going down now. One of the most common comments we have is we will lose control of the messages. Have you got a thought about that, Jeff?
Sorry, can you repeat?
Yes, we will lose control of the messages.
There is concern, and that was one of my concerns, especially with opening it up to responding with others here in the Secretariat. How do we stay on message? What are our key messages? And what we found is that attention is given to the tweets and the messages you make. But people also understand that on social media, it's also a conversation, and they ask for clarifications. So we're not issuing formal statements when we use the social media. We may put out something on Facebook or Twitter that says you can now register, you can do X, Y, and Z, and that's much more straightforward. But as an organization, I'm not so concerned about controlling the messages, at least from our side, because we're trying to direct people to more information and direct people to engaging among themselves. It's not a priority for the Secretariat to necessarily engage, but we want to provide the opportunity for others to engage. And I was distracted before because I saw a question come up about speaking more to the Secretariat's offer to tweet information on behalf of thematic working groups.
Right.
And this is an offer we've put out in the newsletters to all members, and we've mentioned several times to the thematic working groups that if they let us know by email or a direct message on Twitter or just a notification on Twitter, we will share information that they want to get out. We've done this both with one survey, now another survey in a newsletter format, but we've sent out many of our messages. People may not be aware, are actually things that have came to us from members where they asked, would you share our new book, our new article, and so on, news about our conference, etc.
Right. So essentially the organization's platforms are available for everybody, I would say, particularly the thematic working groups.
Yes, if something comes from a thematic working group, it's certainly a top priority for us to get it out to the members and anyone else following us, if that's what they'd like.
Okay. We have another question as well from Elaine, and I'll come to that in a moment. We're not ignoring that. I just want to finish this section, Elaine. And if you would like to talk about that, we can also bring you on in audio or camera. The last kind of fear that we hear is that it will open a floodgate and take too much of our time. We already have too much to do. And I think this is probably true at the very beginning, but I would kind of relate this to network preparedness. There are so many organizations that get to a point where one day they do need to talk to their stakeholders about something that they're doing. They do need to be in a position where they can listen to their stakeholders. And unless you have this network prepared ahead of time, it's just impossible to do off the cuff. And so it can save time, but it's probably in the medium to longer term. And there is a learning curve, and there is kind of learning new tools as well as some of the ideas. So, just interesting, the one I think is the fact here is the one about losing control of the messages. If there is any way that organizations can keep control of the messages in such an open and transparent environment. Let me just go back. I'll stop sharing that for a moment. Let me just go back to the question that we have from Elaine, and if I understand you correctly, Elaine, it's kind of what does that neutral outward-inward breakdown look like when we're talking about analysing the use of social media? And this was something that when we did this analysis, we took something like 15 organisations and we said we wanted to do it very objectively. So we defined criteria for this and said if inward is probably the easiest one to define. It means that someone's talking about their own organisation and their own work. And outward is the opposite of that, where an organisation is making direct reference or giving credit in particular, or thanking another organisation for the work that they've done and recognising the work of another organisation. And then neutral is where we couldn't say either of those things was really happening. So they may be giving an opinion, they may just be sharing data or information. So it was regarded as neither, neutral was neither inward or outward. And the thing that this is actually something that the analysis we've submitted as an abstract for the symposium, and it's going to be presented as a poster. And it's just amazing to look at the variation in the organizations, these 15 global health organizations, as to how they're using these kinds of platforms and their voices. If we had to say who was the most selfless, who talked about other organizations the most, not just in terms of responses, we were quite surprised to find that that was actually the Gates Foundation, an organization that we expected to be talking about their grantees a lot, but they don't. They talk very much about what everybody is doing in their priority areas rather than specifically about their partners or their grantees, which was interesting. So I hope that answered your question, Elaine. We can certainly share some of that data and information with you. I'm just checking to see if there's any other questions before we move on.
I see a question from Anita.
Yeah, it's Anita.
So I can take this, Tim, if that's okay with you.
Okay.
It was asking what would be the best possible outcomes of health systems global's investment in social media communication, with an assumption that frequency of social media communication alone would not be the case, and how is quality and content of messages considered? What would be the best outcome of our investment in social media communication? That would be satisfaction from the users, primarily from our members. Are they happy with the social media communication? Are they feeling that we're making their life a little bit easier? I think, Tim, you mentioned about when we see the investment come back. We've seen it come back already. We're saving a lot of time not having to set up more regular, elaborate newsletters, having to do rapid responses and email alerts, when we can simply do this on Twitter. And then, as everyone will see from this Friday, every week we'll have Twitter updates for those who aren't on Twitter. For those who aren't on Twitter, you can always go onto the website and see the Twitter feed. So I think the best possible outcomes are, like I said, what do our members think? Are they using it? How is it saving us time and thus money here in the Secretariat? And also, regarding the issue of messages, just today we took a look at, how many of the messages were focused on the symposium specifically by looking at the hashtag HSR 2014. And we could see 95 people have been tweeting about the symposium. So, already, months and months before the symposium, we have almost 100 people writing about the symposium, announcing that they're going, that they're going to be speaking, asking questions about the symposium that we're able to try to answer, and so on. So I think we're already seeing, what I'd like to see is the symposium every other year is a place where we all meet face-to-face and discuss health systems research. But in the 2 years between symposia, we continue this discussion online, through smaller meetings, through the webinars, through when people can get together face-to-face. But the symposium shouldn't just sort of start on the 30th of September and end on the 3rd of October. In fact, it's already starting now with the discussions, and we're going to see this really ramp up with the blogs, the webinar, and the LinkedIn as people can discuss the issues, including those not able to travel to Cape Town.
Mm. Yeah, that's great.
Jeff and Tim, can I jump in here and just add to that, please?
Sure. Yeah, please.
Sure. So Mariam to everyone else, sorry. I think also something that we've seen just in the last month is we've gone from having people engaging with us who are mainly active members of the thematic working groups or other people involved in health systems research who are already on Twitter and LinkedIn, for it to become a lot more students are following us, and it's gone from being geographically spread from the US, the UK, and Europe to people all throughout the African continent, Asia, and the Middle East. So it's really extended Health Systems Global's geographic reach within the space of the month. So by the time of the symposium, the network and the dialogue will really have expanded beyond what it would be over just a newsletter or an email.
That's fantastic. We've added on, we're up to almost 1,200 followers, and around a quarter of them have come in the last 6 weeks or so.
Right, right. I hope we're answering the questions as we go through. I think David has a question and would like to join us to ask. So let's give that a go. This, by the way, is the first time we've used this platform. We were using another one last time, so this is a kind of a trial to see which platform we'd like to use ultimately. So if we do have any gremlins today, please bear with us. And I think David is being connected now. Is that right?
Okay, sure. I mean, first of all, I like the GoToMeeting platform. It seems to work well for the audio, visual, and for the slides. No, my question is really about not necessarily to answer now, but there is the concern about the noise and the extra work. And I noticed just in joining LinkedIn to get on for our thematic group that now I get, probably about 5 a day. It's not really a floodgate of people who I don't know, who I then see, who, if they are even linked to Health Systems Global, who basically they ask if you can verify that you know them, and then you get linked to them. Now, and it's not that big a deal. It's pretty harmless, but it's a type of thing that you'd like to be able to limit, and it's one of the irritation factors. But or maybe it's an opportunity that I just not taking up. But it's the additional costs of transactions that would be good to know how to seamlessly reduce the ones you don't want and to maximize the ones that you want.
Mm-hmm. I can respond to that a little bit in terms of content, but not in terms of contacts. Because one of the things that we've been doing over the last month or 6 weeks or so has been to, in the background, develop more of a kind of a content, not a filtering system, but a content curation system. And so we've been scanning around the internet, looking for places where health systems research information is commonly found, and then using a kind of a behind-the-scenes platform tool to kind of filter and curate that, so that when things do reach Twitter or LinkedIn, they've already been through a kind of a considerable selection process already, and that removes probably 80%, maybe more, of what you might regard as noise in relation to content, which we think is also as quite, we're trying to make sure that the information we share has got added value for the members receiving it. In terms of contacts, I think that's just a factor of more exposure, that people are hungry to make connections with people, and you either have to be very efficiently ruthless, or invest lots of time in making sure whether or not people really are genuine or not. I think that's just a fact of the online life.
Tim, you manage a group of, I think, over 70,000 people on LinkedIn. So obviously you have more experience than anyone I know in dealing with this. So what choice did you make? I can say from my side, I simply don't accept. I see a LinkedIn invitation come, and if I don't recognize the name, I don't reject it. I just don't accept it, and I let it fall down the list. And it takes a few seconds. And that's that.
Yeah.
But you must receive thousands of messages.
Yeah, I do, and we do in the group as well. It's actually 80,000 now. It's gone up. It's jumped by another 10,000. But this is a global public health group, and we'll be using this to publicise, the health systems global platforms too. I get approached a lot by individuals who are seeking work, who are seeking introductions to other people, and honestly, I try to trust their motives as much as I can, and I will kind of reach out to them once if they have a question, or they have something that they're looking for, or they're looking for some advice. I had somebody wrote to me today in Egypt, and she's thinking of starting. She's been accepted for an MPH program, and she was asking my general advice about whether I thought that was a good career move. I mean, who am I to tell her? But she's asking my opinion, and I just sent her a one-line note back, a couple of paragraphs saying what I thought, what my perspective was. So I try to be as open as I can. But in terms of connections, obviously I want to keep my network as kind of clean as I can. I reject anybody that I think is suspicious in any way. But also on the group, we have to have very strict rules about what people are allowed to post and what they're not allowed to post. And we've started to do that with the welcome message for the Health Systems Global Group on LinkedIn, saying, if things are off topic, they will be removed, just to try and keep the noise levels down. Okay, I hope that answered your question, David, or partly. Where are you, by the way? Oh, he's gone. He's nowhere.
He might be muted, but he's at Hopkins.
I'm in Baltimore, thanks.
Okay. Well, thank you for your question. I think it would be good to move on to some of the more individual issues. And one of the things that we thought would be good, if we're not going to try to build people's capacity directly, because everyone has varied needs, we just thought it might be good to look at some of the main factors which are often referred to in relation to social media as good for return on investment. And just really try and kind of make them visible for the people on the call, so that we're not just talking in abstract terms. And Jeff, please stay on, and as I share some of these,
I am.
Share my screen again. One of the first points that everybody says when you're using social media, either as an organisation or as an individual, is that you should work to a plan, that you should have specific goals and stick to them. That social media is a kind of a bottomless pit in terms of time if you're just kind of randomly grazing and sharing information. And so we thought it might be good to show you what part of the plan looks like. We've been working with Health Systems Global for a while now, as we said earlier. So this document that you can see here in a second, I think we're just waiting for it to catch up, right? So this, for those of you who may not have seen anything like this before, this is a content plan for the work that we're doing to support the social media platforms. For now, this is a changing document and a working document. So it shows that we are estimating that around 30% of the content, and this is primarily for Facebook and Twitter, because it's not so much member generated at the moment like LinkedIn. So health systems research and technical issues should be about 30% of the content. Integrating health systems research into strategic global health moments and developments should be about 20%. Global health in general, and relating that, for example, health systems and universal health coverage, about 15%. Key symposium and HSG partners, news and positioning. So this is kind of some of the more inward stuff related to the symposium, and the symposium specifically here. And then about 5% of kind of corporate information for HSG. I don't know if Mariam is still on microphone, on audio. She can probably tell us how well we're. Okay. How well are we sticking to this, would you say?
I'd say that's changed since we started. It was useful that as we've sort of got to grips with what research is actually coming out of health systems and focusing more on the people-centeredness, that's really shifted, and I've done another version of that.
Okay. Well, it was just really to make this visible so people see when we talk about defining a plan and a strategy that we're doing this literally. And I'm actually pleased that it's evolved because it shows that it is a moving
Yeah, no,
start.
it has been very useful. And I think this goes back to sort of what David was asking, and what I was saying earlier is that we need people to be driving this content. Everyone who's involved in this call, you know what's on the cutting edge. So the more you can engage on social media, the more we can be tweeting what's applicable and helping the plan to evolve.
I also think this is a plan that we might need to look at over 1 year, over 2 years. Right now, there's a strong focus on the symposium and really all things people-centered as we gear up for the symposium. That would then trickle down. We would be focusing on other issues and then looking at what the next theme of the symposium is. So this has changed a little bit, but maybe it hasn't if we look back at it in about a year's time.
Right. Okay, I'm just going to switch back to the slide if I can. The next kind of key factor, which is generally recognized in the social media discourse, is that success on social media is really about being generous and what you give to other people rather than what you take. And one way that we often describe this is to remember that very often if you're in a meeting or you're reading something or you're part of a discussion or a project, you should see yourself as the eyes and ears of other people who don't have that perspective or that privilege of information. And that kind of also ties in, if you like, partly in some ways the opposite, which is to develop your skills of listening. And this goes back to what we're talking about two-way conversation. And people are always surprised when we show them some of the tools that we use. And for some people who don't use these tools, it's quite surprising. So this is a typical kind of Twitter stream. This is actually live now. This was something that was posted 3 seconds ago. And I follow 10,500 people. So there's no way I can follow this incoming stream. It's just too much. So we have to listen in a selective way. And I'd just like to show some of the platforms that we use. This, for example, is a tool called NetVibes that should appear on your screen any moment. With the internet connection, can you see that? Still on Twitter.
I see NetVibes on mine.
Okay. I'm looking at parallels across the room. So this is a way that we this is a dashboard that we have for looking at health-related blogs. Some of you will recognise Humanosphere and Karen Greffen's Global Health blog. But you can, and at any point, you can say, oh, this is quite interesting, something from PLOS on obesity this week, and I can go in and get a summary of that. But you can also see that this has got a huge number of topics across the top here. If I want to look at things to do with hepatitis or other topics, and in fact, one I'm active on at the moment is looking at the discussion around e-cigarettes. And instead of looking at blogs or news sites, I can be looking at videos or what has been said on social media. Now, without these kinds of dashboards, listening is impossible. And another one that we have to help us kind of filter out all of the discussion on Twitter, to fall asleep, this is a platform called Hootsuite. And this, again, is just one dashboard tab. And I'm, for example, in this column here on the left, I hope it's appeared. Can you see that yet, Jeff?
Yep, I see it.
Okay. Now, for those of you who've not used Hootsuite before, this is a way to follow specific hashtags or specific users. So here, for example, I'm following anything where anybody mentions WHO, anybody talks about tuberculosis, anybody uses the global health hashtag. And with that, and malaria, TB, I'm looking at massive online courses and e-cigarettes and things like that. And again, we've got filters looking at the content from social media. Otherwise, it would be impossible. Just one more I want to show you. This is a thing called Tweeted Times, and of the 10,000 people that I follow, this is a kind of a, if you like, it collates the most popular things that those people tweet, and it's just in a newspaper format. So I look at this each morning, and I can see among those, among those 10,000 people, these have been the most actively shared articles, and this is real time, so this just gets updated every 20 minutes or so, whenever I open it. Now, this for me is what I mean by listening, and it's just impossible to do it any other way, and it might be a bit daunting for people who are kind of new to social media, and they're hearing this kind of this mantra of listen to other people. This is how they do it. The other thing I just wanted to share was about hashtags and hashtags working. I'm not sure if I opened it. No, I don't have it open here. I was going to show you an analysis of one particular hashtag, and Jeff already mentioned the use of the symposium hashtag. I mean, what we see, whatever specific topic it is, people are tracking individual hashtags, and they're doing it with statistics as well as content. So we know for a fact that these hashtags work, and people follow specific words and keywords that you might say. And the last point really is just to remind everybody that to remember that the people that are following you. They want your opinion, so you shouldn't be hesitant about adding your views or yeah, saying what you think. Adding value is often saying things like, I like this, or this doesn't sound very convincing to me. That means a lot to other people, and that's why they follow me. Okay, really the last thing we wanted to move on to was to just get some feedback, or just to share some ideas of next steps. And this is some things that we've been discussing together with Jeff as possible priorities. And this comes back again full circle to talking about individuals, and in particular the thematic working group members and the board members. First of all, over the last few days in preparation for this webinar, as I say, we've found some really amazing online learning materials about how to use social media that we didn't actually know about before. And we'd assumed that we would have to develop these, but we won't now. So what we'd like to do is to share an inventory of those kind of online learning materials with everybody that was invited to this webinar, because we think that would be really useful. Maybe even having a set of links on the HSG website so that members can just help themselves to these, have a menu of self-help modules. Of course, we'll kind of screen those and make sure we don't recommend anything that is not useful. The second point is we're kind of gearing up to provide support and training, and really this is kind of almost like kind of one-to-one training, because there are general materials available to help focal points and board members according to your immediate kind of goals and time availability for using social media. Now, some of that we're going to get from the survey, but this is likely to be very specific and customized to each person. It might be that you'd be interested in seeing some more of those dashboards, or you'd like to think about developing specific skills for a particular social media platform that you're new to, or we just have a feeling that it's going to be very specific, and we would like to offer online support, one-to-one support, how-to materials, which a lot of people responded positively to in the survey, and also to follow that up, and that's the third point here, to follow this up with a face-to-face workshop during the symposium in Cape Town, just as an opportunity of all being there together, and to be able to kind of sit and talk through on a one-to-one or in a group. Jeff, I know we've talked about these, but even we've learned some things over the last few days, and we're kind of focusing, we're homing much more on this whole kind of personalized approach. So I don't know if you have any thoughts about that, or if anybody else does, whether this would be a welcome support, and well, any other thoughts that you might have?
I think it would be great to hear what the participants online think about this, and since we're recording and we hope others will view this, they can always email us afterwards. My immediate reaction, which you're aware of, is, initially Health Systems Global has been helping the thematic working groups set themselves up with
Muted.
Dropbox storage, a Google group, a spot on the website, and so on. And what we want to do is really go this next step and say, well, how can we help you get your messages out there online, reach just your members through a closed LinkedIn group, or foment wider debate through the Health Systems group or your own thematic working group on LinkedIn, but a part of the Health Systems Global family. So we've also already had a couple individuals ask us to help them sort of just get started on Twitter, and we've been able to do that. But to really go the next step and scale this up, well, we need to know, that the members are really interested in this, that they'll put some time into it, and that they think they'll see some of this return on investment that we described. So I know that we're about to wind up. Go ahead, Tim.
I'll just say David has just sent a note saying next steps look good. Thanks very much.
Great, thank you, David.
Yes, we probably should wrap up. It's an hour now, so we've actually overrun by 10 minutes or so. I guess
Yeah, I'm just finishing the webinar. Finish now. Just using
I
the
think
phone.
everybody is on microphone at the moment, so we should probably wrap up. I think that was an opportunity to give everybody a chance to say what they thought. So maybe we should just kind of end with that. If anybody does have anything that they would like to say about these proposed next steps, please do. Otherwise, we will be reaching out on a group by group and individual basis in the coming weeks.
Great. Well, thank you, Tim, for moderating, and thank you everyone who was able to tune in.
Yes.
We really, really appreciate it, and thank you for your commitment to Health Systems Global and to taking the time out of your schedule today. Thank you.
Yeah. Thank you, everybody. I think we're gonna wrap it up there, and we'll let everybody know where the recording of this will be. It's the first time we've recorded something on GoToWebinar, so we're interested to see how that's worked.
Great. We'll tweet it out, email it out, and reach it out to everyone we can. Thanks, Tim.
Thanks, and good night from Chiang Mai, everybody, and thanks for the people working behind the scenes here, in particular, Barry and Mariam, who've been pulling the strings while I just talked. Thanks, everybody.
Thank you all. Bye.
Bye.
Bye-bye.
Thank you. Bye. Bye. Bye.